Dr. Simons, a vascular surgeon at UMass Memorial Medical Center. On behalf of our team, I want to thank you for choosing us for your care. At UMass Memorial Health, we believe that this is the best place to get care and the best place to give care. The following video will help you better understand what will happen before, during, and after surgery. Thank you for trusting UMass Memorial's Division of Vascular and Endovascular Surgery for your care. In terms of your preoperative planning, after you've made the decision to have surgery, our office will reach out to you to confirm a date for surgery and to give you additional information about what will happen before surgery, including your pre-surgical evaluation. About 7 to 14 days prior to your surgery, you will meet with our pre-surgical team at the Memorial Campus at 119 Belmont Street in Worcester. During this appointment, you will meet our anesthesia and nursing teams. You'll have lab work completed, have an EKG done if needed. We'll review your medications and health history and give you a physical exam. Be sure to bring an up-to-date list of medications with you. We will review what to expect during your procedure and ways we will take great care of you after your procedure. You will get a phone call the day before your surgery with an arrival time. This usually occurs sometime between 6 a.m. and 11 a.m. We will explain when to stop eating and what medications to stop taking or keep taking before surgery. If you're on blood thinners, this plan should already be in place prior to your procedure, as you may need to stop taking them depending on what type of surgery you are having. In terms of the day of surgery, you'll come to the university campus at 55 Lake Avenue North. You will use the Remillard Pavilion main entrance and follow the signs to the D elevator to the second floor. This is the surgical admission area where your family can wait during surgery. When you arrive, you'll see the nurses and the anesthesia team. They will place IVs, possibly a line in your wrist that measures your blood pressure. Your vascular anesthesiologist will make sure that you are very comfortable and send you off to sleep. Your operation can last anywhere from 4 to 6 hours. After your surgery, your surgeon will reach out to your family to let them know that you're doing well and in the recovery area. We will let them know when and where they will be able to visit you. Post-operatively, you'll go to the post-anesthesia care unit or directly to your hospital bed, depending on your operation. Our vascular team, including nurses, patient care associates, and case managers, will be with you throughout this process and begin to help plan your discharge. Some mild discomfort can be expected after surgery. Medications and other interventions can keep you comfortable. It's not unusual to have some numbness at the surgical site also. This usually improves over weeks or months. After surgery, we will ask you to move around as much as you can tolerate. This improves circulation and helps prevent complications after surgery. We implemented an eye cough practice to help prevent pulmonary complications such as pneumonia, blood clots, and other lung or breathing problems. The I in eye cough stands for IS device. This is your incentive spirometry device. You'll learn how to use it, which is critical to your recovery. The C stands for coughing and deep breathing. You want to do this several times a day to help your lungs expand. O stands for oral care. Brushing your teeth and using mouthwash should be done twice a day. U stands for understanding why these steps are important to your recovery. G is for get out of bed. We want you to get up and moving as soon as possible to help prevent things like blood clots from forming and to help speed up your recovery. H is for having the head of the bed elevated at least 30 degrees to help you breathe. Our team will make sure you and your family have all of the tools available to help prevent complications. Your commitment to your recovery is very important. In terms of your discharge, our office is going to call you about 48 hours after you're home and ask you a series of questions regarding your recovery and allow you an opportunity to express any concerns. A nurse practitioner or your surgeon is available if any concerns need to be escalated. Once you go home, you may resume normal activities as you feel you are able. You should be up and walking around your house several times per day. Walking outside and doing stairs are acceptable, and you can increase your activity as you can tolerate. Avoid aerobic exercise other than walking until your follow-up visit, which is usually about 2 weeks after your surgery. You may return to work or school as you feel you are able to do so. There should be no driving for 24 hours after surgery and never while taking narcotics. If you have dressings over your incisions, keep them clean and dry for the first 48 hours. Don't shower at this point. After 48 hours, you may remove the outer bandages over your incisions and shower. You should wash and dry the wounds gently with soap and water. No dressing is needed after 48 hours. Don't soak in a tub or a pool though for at least 2 weeks following surgery. As far as your diet is concerned, there are no restrictions. You may want to start with small portions of bland foods that are easy to digest for the first 2 to 3 days. You should keep well hydrated as your body is recovering. Try juices, water, broth, sports drinks. Having surgery and taking narcotic pain medications can cause constipation. Here's what you can do. Start taking a stool softener, Colace, or generically Docusate sodium, starting the day before your surgery. You should take 100 milligrams of this twice daily. If you go more than 2 to 3 days without a bowel movement, you should take 2 tablespoons of milk of magnesia 3 times per day until your first bowel movement. We're here for you 24/7. Please contact us with any questions.
Hi, I'm Dr. Andy Schanzer, and I'm here today with Gabrielle DeVivo, our vascular surgery nurse, to talk to you about your endovascular aortic repair. The aorta is the largest artery in the body, and when it dilates, the wall gets thinner and weaker and can rupture. When your risk of rupturing is greater than the risk of continuing to closely monitor it, we consider surgery. You may need this procedure if your aneurysm has reached the repair threshold of 5 centimeters, or if it is getting larger and your surgeon believes your aneurysm is at risk of splitting or bursting. There are several ways to fix aneurysms. One of the most common and widely used repair strategies is done using stent grafts, also known as endovascular aortic repair, or EVAR for short. In addition to EVAR, you may also hear your doctor refer to the procedure as a thoracic endovascular repair, TEVAR, or fenestrated endovascular aortic repair, FEVAR, depending on the type of repair that is being discussed and your specific aortic anatomy. This treatment is done to help prevent your aneurysm from becoming a problem and fix it before it ruptures or causes death from rupture. EVAR is typically done with small cuts or incisions in your groin while you are under general anesthesia, meaning you'll be asleep. Through those small incisions, thin, flexible tubes called wires and catheters are threaded through the artery and guided to the site of the aneurysm. A stent graft is then advanced over the wire and catheter to the aneurysm. The stent graft is opened inside the aorta and fastened in place. This stent now becomes the new passage for blood to flow through, so it no longer flows into the aneurysm. The procedure can take anywhere from 1 to 6 hours, depending on the anatomy, and because of the smaller incisions, there is a lower risk of complications and a shorter recovery time than an open aortic repair surgery. I'm now going to turn the conversation over to Gabrielle DeVivo, who is going to tell you what you can expect after a procedure.
Thank you, Dr. Schanzer. After this procedure, you will wake up in our recovery area and then be moved to your hospital bed. You may have to lie flat for a short time and not bend your leg, and you will probably be a little sleepy. If you have any pain, it will be controlled with medications. Many people have a little tenderness in the groin, but for the most part are relatively comfortable. It is important to drink plenty of fluids, unless we advise you not to. You can eat your normal diet. Often people can lose their appetite after surgery, but it is important to maintain your nutrition to help you heal. Small, frequent meals may be needed, and if you have any nausea, try eating bland foods at first. Walking is also important after surgery. Start by walking a little bit more each day than you did the day before. This will help you regain your strength and recover faster. It also boosts blood flow to prevent things like blood clots, constipation, and pneumonia. Most likely, you will have glue to close up the small incisions. These will fall off over time. It is okay to shower 48 hours after surgery, but keep the area clean and dry. Dr. Schanzer, is there anything else you would like to add?
Yeah, thanks, Gabby. It's very important to make sure you get the appropriate care after your surgery. Our team will follow this repair for life, as they will occasionally require follow-up procedures over the lifetime of the repair. You can expect to be in the hospital anywhere from 1 to 3 nights, sometimes more depending on the complexity of your repair. Once you go home, you should continue to feel better each day, but give yourself a good 3 to 4 weeks to feel like you did before surgery. During your recovery, there are some things we would want to know about, such as any increased pain, swelling of the legs, redness, drainage, or lumps in the groin area where your incisions are, or any other concerns that you may have. Thank you so much for choosing the UMass Memorial Health's Division of Vascular and Endovascular Surgery for your care. We are here for you 24/7. Please contact us with any questions you may have.